Good morning, good afternoon. I am Lizz Ntonjira, the Communications and Engagement Director at WomenLift Health, and thank you so much for making time to join us today to discuss some important learnings in investing in women's leadership and in women leaders. We at WomenLift Health are deeply committed to empowering and advancing women in leadership positions, recognizing the transformative impact women leaders can have on global health and gender equality. Each year, our partner Bixel conducts an independent evaluation of the WomenLift Health program, and I'm very excited to discuss the 2023 report with you and share some really insightful findings and key recommendations. The report reflects the ongoing efforts and achievements of our organization in expanding leadership for mid to senior women in health. Drawing from online surveys completed by 168 women, 74% response rate, I must add, 23 key informant interviews, monitoring and program data, and case studies, it highlights the change that the participants underwent during and after participating in the leadership journey in East Africa, North America, and India. This report is available on our website, and for easier reference, we'll share the link on the chat section, I'm sure, which has already been shared. We will delve into this report through 3 rounds of questions with our panelists. We'll begin by exploring the impact of leadership investment on the women leaders' personal development and growth. And then next, we'll explore how these personal changes are reflected in the behavior and actions of the women leaders in the program, in their own careers, their institutions, how do they pay it forward, and their work collectively in global health. Lastly, we look to the future, exploring potential implications of the program as it scales to thousands of women leaders in health. Following the panel discussion, there will be a Q&A session. So please write your questions, your thoughts, your comments, your feedback into the section marked as Q&A at the bottom of this, the image. My colleagues will be collecting them throughout this discussion so that we can pose them to the panelists later in the session. To discuss the findings, we are joined by 3 distinguished panelists, 2 alumni of the leadership journey from cohorts around the world, and 1 panelist who is at the forefront of leading research, particularly in relation to gender equality and health. I will start off with Ms. Debora B. Freitas López. Ms. López is the Executive Director of the Johns Hopkins Center for Communication Programs, specializing in global social and behavior change initiatives related to health. With extensive international experience, she excels in communications, program design, strategic planning, and partner engagement. She's also a WomenLift alumni from the 2022 North America Leadership Journey. Next up, we have Sanjana Brahmawar Mohan. Dr. Mohan is the co-founder and director of Basic Healthcare Services, a non-profit in southern Rajasthan, India, focused on primary healthcare for tribal communities dealing with malnutrition and preventable mortality. She is alumni of the WomenLift 2022 India Leadership Journey. Last but certainly not the least, we have Dr. Sarah Hawkes. Dr. Hawkes is the director of the Center for Gender and Global Health, Professor of Global Public Health at the University College of London, and the co-founder and co-director of Global Health 50/50, an evidence-driven initiative to advance action and accountability for gender equality in global health. Thank you all so much for being with us today and sharing your unique perspectives, voices, and experiences. Welcome to this webinar. To start our discussion, I'd like to explore what has been the personal experience of women leaders who've participated in the signature leadership journey. And I'll start with our alumni, beginning with Sanjana.
Hello, everyone. The leadership journey has truly been a milestone event. I'll start from the beginning. The 360 degrees helped me understand myself more, both my strengths as well as where I could do better. I was happy to know that people appreciated my patience, my being available whenever they needed to connect. but I also realized I needed to let go more and have my team really drive the work. And also go beyond what was directly in front of me to look also at the big picture. The leadership sessions, the coaching, mentoring, I think this kept the exploration and the learning going. I learned about different influencing styles based on different situations. I learned about maintaining a personal professional balance, and both of these directly connected to my 360. I learned about coaching others in ways where you are not guiding, but helping them find the answers themselves. So all of these also made me see, and in fact made all of us see, that so many of us peers go through such similar experiences. And I'll also add that the warmth, the space, and the encouragement that was there among everyone, something I felt very deeply. So I see my leadership as changing a lot now. I see it as acknowledging, encouraging, mentoring my younger colleagues, especially women, but also men. I see it as being honest, being authentic, sharing what I am certain about, but also sharing my doubts. It is sharing my joys and also what pains me. And all this time to also remember the goal towards which we all are headed. And in the end, I'll just talk a little about what all happened last year. So I have helped my organization build more partnerships with organizations, with institutions, individuals, for making our workplace safer and happier for women, understanding lives of rural women, documenting their stories. This about sums it up. Thank you.
Thank you. Thank you so much, Dr. Sanjana, for that. I think you are spot on leadership always being evolving. And I like the saying that we're all in a state of becoming. We're always learning and unlearning. And that's really brilliant on how you articulate it. I'm so I'm pleased that Dr. Susan Kiwanuka has been able to join us. We were having a bit of technical challenges. So we have an additional panelist. Thank you so much for making it. Dr. Susan Kiwanuka is a senior lecturer and the head of health policy, planning and management in the School of Public Health at Makerere University, leading the Knowledge Translation Network for Africa, focusing on capacity building and policy engagements in 9 African countries. She is a WomenLift alumni from the 2022 East Africa Leadership Journey. And I'll get you already started, Dr. Kiwanuka, on what was this leadership experience for you?
Hello, everyone, and thank you for the opportunity to contribute to the discussion on the table. Being part of the leadership journey was truly a blessing. And for me personally, it came in the year I was appointed head of department at the School of Public Health. It's not a small job by any means, because I'm heading professors and I'm not a professor myself. So I felt like I was in deep water. But the leadership journey, especially the 360 assessment, which Sanjana has talked about, was so good at showing me what my seniors thought about me, what my peers thought about me. And I was able to actually put myself in perspective. I realized that I was actually underrating myself a lot, yet people actually viewed me in such good light. So I think the 360 degrees was such a good thing. And I found that being part of the journey opened my eyes to the same experiences by the women in the same cohort. So I think that was a good start. The other thing about the journey is that it helped me to identify my leadership style. I am usually very commanding. I expect people to just do what they need to do, really. But I realized that not all cows are the same. We have this saying that not all cows move at the same speed. And I'm not calling my people cows, but cows move at different speeds, and you have to understand that some cows need to be beaten, others will go way ahead of the others. So I understood myself, my leadership style, but I also understood my team and their expectations of me as a result of this journey. I was also able to balance. One of the challenges I was having was balancing the work and the home. It was really tight, and that is something we really navigated with the mentor and the coaches throughout the journey. So I think having a mentor and a coach as part of this journey was brilliant, because it took us back and made us really constantly assess and set targets and be able to assess ourselves and how we were growing. And in terms of my confidence, I think the journey helped me to learn to accept opportunities. In the past, I would really pass off opportunities, but over the past year, I have accepted opportunities, 2 opportunities to give keynote addresses. I am now a board member on 2 big what should I call it? I'm a board of chair. I'm on the board of 2 different organizations, and I was inducted as a fellow of the national, the fellows of Uganda National Council of Science. So I have been taking up these opportunities where before I would probably tell them, I probably don't have time for this. So the journey has taught me to put my foot forward, to put my best forward, and contribute to leaving a legacy, and also to show that women need to take up this space. In terms of how I have influenced others, being in the leadership journey actually opened up my eyes. I had been aware of this before, but I had no idea how disastrous it would be to leave women untapped as we move into trying to change the way things are done. And my project actually was looking at leadership of women in the pipeline in the university. And I realized that we have waves where women come to the top and they're in leadership, and then you'll have a decade or 2 and there are no women to be seen. And I was talking to my peers and my seniors that we need to be more intentional about getting women into the pipeline. Otherwise, our gains are quickly eroded, because the men are always, they don't need extra support. The women do need the extra support. So that is part of what I'm trying to influence. In terms of networking, being part of the alumni, I think it has been just brilliant. I'll stop there.
Oh, thank you. Thank you so much, Susan. I think you bring in a very pertinent point around self-awareness as leaders. What's your leadership style? What are some of the key team members, and what are their personalities as well? And how can you bring out the best of everyone? Over to you, Debora.
I will have to say that I will echo my colleagues, Sanjana and Suzanne, with regards to some of the experiences that they had. Although we all experienced the process in a similar way, we all received the experience in different ways, and because we're all different people and we're all different women. I'll have to agree that the 360 was very useful, because sometimes I feel that women in general, we have a lot of self-doubt about who we are as leaders. Even if we don't vocalize it, there's a little person inside us, like continuously questioning if we're doing the right thing or not. And for me, the 360 assessment affirmed that, I am a leader. I just need someone to embrace me and help me strengthen those and externalize who I am already. And so I do feel that between the learning, the leadership sessions, the coaching, the mentoring, they were all very useful, and really helped me realize the type of leader that I am, while also recognizing that I'm going to stumble, and I need to give myself grace for that, and that I'm going to continuously evolve. think the other thing that I really appreciate and value so much from this experience is the network of women. In addition to the cohort, I feel that, you know, this is my first time meeting Suzanne, my first time meeting Sanjana and Sarah, but I feel like we're in this together. And there's nothing like that type of sisterhood. This program did give me the confidence that I needed to apply for the position that I have now. And it has equipped me as I work to do a lot of change management in the organization. And so with again, grace and giving myself a little bit of liberty to be okay with who I am and understanding that I'm continuously learning like everybody else is. I do agree that women need this. I think that we're pushed by society to do so many things and be perfect in so many different ways. And having this organization has reminded me continuously that we don't have to be perfect. We just have to be intentional about what we want and what our vision is. And that includes not only in work, but also at the personal level.
Oh, wow. Thank you. Thank you so much, Debora. I love that. Sisterhood and progress over perfection all the time. Thank you for those insights. Now, Sarah, over to you. You've reviewed the evaluation report, which highlights data at the cohort level, as well as sharing insights from the key informant interviews. Would you share with the audience a few of the key takeaways or findings that struck you regarding how leadership programs have an impact on women as leaders?
Thanks, Liz, and thank you to my fellow panelists for sharing the kind of richness of the qualitative data that comes through in the evaluation report. It's really, really great to hear your personal stories, because as I think, as we all know, whilst data and pie charts and bar graphs have a place, it's actually hearing people's personal stories that kind of puts life into the data. So it was great to see the evaluation, and to read. I mean, partly just for clarity for people who haven't had a chance to look at the evaluation of the program so far. The report presents data from 3 countries, so from the US, that might be North America. So is that 3 countries?
3 regions, 3 regions.
3 regions. Thank you for the clarification. I realized my geographical knowledge was about to be put to the test. Okay, so we've got 3 regions, but essentially, as far as I could tell, it's North America, and then it's India and the East Africa region. And I guess one of the things that really strikes me is the similarities. That, you know, there's no kind of standout difference, which I think is kind of what we'd expect. That given where challenges and discrimination and the embedded nature of patriarchy everywhere in the world, it's kind of not a surprise that women have faced the same challenges everywhere in the world, and that where an opportunity exists to try and break down some of those challenges, to counter that discrimination, to ensure equality of opportunity for women in the workplace and the workforce, that women benefit from those interventions in a pretty similar way across the regions. Obviously, with the next evaluation, well, not obviously to everybody, but the evaluation report goes in detail more in the North America region, because that, as far as I can see, has been running for longer. So there's kind of a better data set, or a more robust data set from there. And for future evaluations will undoubtedly uncover more richness of data from the other two regions. But right now, I think what struck me really is how the evaluation really illustrates some of the kind of core principles that the theoretical literature tells us about women's journeys to leadership. And first of all, it's that leadership is not just about the nominal job category of quote unquote a leader at the very top. That leadership is practiced at all levels of an organization. So it's fantastic to see that this isn't just about taking people at the very top of an organization and training them to be better people. It's about recognizing leadership throughout a career journey and really working with women at all stages of their career progress. And the data really shows that women across all levels of an organization are reporting the same kinds of changes in both in their knowledge, in their skill set, and in their practice of leadership in the organization. I think the second thing that it really shows, I'll put a name to it. What the report really showed to me was a very clear practice of feminist leadership. And I want to make a distinction just for absolute clarity. I'm not talking about feminine styles of leadership, which may have been a kind of misunderstanding about what we're talking about when we say we want feminist leadership. We're not talking about feminine leadership, meaning, a kind of prejudice that women exhibit a certain kind of leadership style. They're more compassionate, or they're softer leaders in some way, i.e. counter to the previous idea of what a leader looks like. But feminist leadership that is exhibited at all levels of an organization, as I've said, but B, is about collaboration and is about transformation of the systems and structures, and is about the redistribution of power away from the idea that leadership is some kind of tangible idea and measure that is only held by people at the very top. So what I've seen in the evaluation report is the measurement, the positive measurement of the redistribution of the qualities of leadership, the skills of leadership throughout the organizations that women are working in.
Oh, wow.
Leave it
Great.
there for now.
Thank you. Thank you so much, Sarah, for those really critical insights. Now, we've had compelling stories of personal growth across diverse cultural environments. I'd like to explore now a bit of the so what. Does this personal growth as a leader show up in the behavior or actions, for example, with the teams, institutions, in the health work, in the collective community? And I'll begin with you, Sanjana. In your work, you were particularly struck by the challenge faced by nurses in rural Rajasthan and decided to address them in your leadership project, an element of the journey which is mandatory. Would you briefly share a little more about this?
So I've worked with nurses in rural Rajasthan for over 20 years and saw the huge challenges they were facing, from controlling families that wanted to take all their decisions by themselves, and hierarchical health systems and people in the system who were unsupportive, who were indifferent. And so we would see nurses struggling to manage their lives, their work, with little confidence, little motivation. And building their self-efficacy was what my leadership project aimed to do. So really, when it began, it was an idea. But then the idea just grew. It took shape with the ideas coming from the WomenLift Health community, my peers, the WomenLift Health team. They all contributed to developing it more. So did my colleagues Also faculty at the Indian Institute of Management in Udaipur, faculty from London School of Economics, a dear colleague working with a well-known development fellowship in India, and also some of the senior nurses themselves. So from all this, it became clear for nurses to build their self-efficacy. It needed a strong agenda to build their knowledge and skills. So for us working in the space of primary healthcare, it meant building their skills in maternal health, infectious diseases, and more. It needed mentors who worked closely with them, who were available whenever there was an emergency, who understood the nurses, and who helped nurses find solutions to their problems. It needed a strong connect with their families to share with the families the great work, the life-saving work the nurses were doing. Often we would see the families had very little clue of the wonderful work that was being done. So we thought taking it to them was also important. And all of this in an environment of dignity, of respect. And what I saw clearly that when all of these were in place, there was a lot of change, a transformation among the nurses. So we saw nurses negotiating more with their families and continue to work. Earlier, we would see nurses also quit in times of problem, but now more of them were negotiating. They were also expressing clearly, they were putting their thoughts on the table, whereas earlier they might have stayed quiet. So all this work till now I have done with nurses working within my organization, but I'm also happy to share that in the last several months, we have started working also with the government nurses and midwives. And we hope for a positive transformation there as well.
Oh, wow. I will repeat what Ginger Cameron says. What a wonderful outcome. Please do keep those comments coming, share your feedback, your questions in the Q&A. Thank you so much for those insights. And Debora, moving to you, I know there's something you did allude to it in the very beginning, the shift in the job. You're now the executive director at the Center for Communication Programs at Johns Hopkins. This was a big and very exciting job shift for you. Can you tell us a bit about your journey to this new position?
Yes, this position was opened while I was going through the program and my journey. And it was interesting that when I saw the position, I said, wow, I wish this position was open 10 years from now. I'll be ready to have a position like this 10 years from now. And a few weeks later, or a couple weeks later, we had that leadership session where we talk about how women always feel like they have to check the entire checklist of a job description, whereas men, they could be even 60% compliant with the job description and they'll apply anyways. And I was considering it, and I was talking to my husband that happens to be one of my greatest cheerleaders. And he's like, you should consider this. And when I talked to the recruiter who had reached out to me, I actually had a list of people that I thought should apply. And as I'm going through this list, the recruiter shared with me that she had spoken to many of those people, and they actually had recommended that I apply. And so, between that session and speaking with actually my coach and my peer mentoring group, and really thinking through the position, I realized, you know what, I'm not going to lose anything by applying. No one's going to have to know that I applied. And I did. And I was just continuously intentional at every step of the way. I embraced the tools that were given to me and how my skills were strengthened through this program. And it was almost as though every other leadership session or every coaching session that I had or mentoring session that I had leading up to an interview phase was preparing me for that interview. With that, it was like the universe was coming together for me. And I was just very thoughtful and intentional, really pulled my inner leadership for this position. I really wanted it. And eventually I was selected. And I continue to do that. Every day I try to be as intentional as I can be, recognizing that sometimes, you know, we all have some bad days. But, you know, being authentic and being vulnerable and being inclusive to those around me, and ensuring that I am paying it forward, because I feel that this program has been a gift for me in so many different ways. And you know, for those women who haven't had the chance to take it, I at least try to incorporate some aspects of what we've learned and what we continue to learn, because we still have sessions available to us as alums, and how I speak to them and even men, you know, so I try to be as inclusive as I can.
Wow.
And that is, I'm not going to say that is my journey, because we've all learned that our journey continues, but that is a part of my journey now.
Oh, wow. I love that. I love the fact that you brought in the aspect of male allyship through your husband, the fact that a lot of times people see the potential that we don't see, and everybody that you had listed had actually recommended you. And most importantly, just, you know, having the confidence to do it and put in, and you have nothing to lose. And what Debora is basically saying is apply for it, go for it.
Yeah.
You have nothing to lose. Susan, how have you placed emphasis on promoting and prioritizing women's leadership within the university's department, and also in encouraging more women to join the field of public health?
I wouldn't say that I have encouraged women to join the field of public health, because that has kind of happened organically, but I have had the opportunity whenever I'm teaching to encourage them to move faster than I have moved. I realize that as women and as women leaders, many people look at us and they think, wow, they have really made it. And then you look at yourself and you feel, I could have done so much better. I would be so far by now. So the leadership journey helped me to realize that women need that push. And if many of us had got that push even earlier, we would be so far ahead. So whenever I'm talking to the young people, I tell them, don't waste time wasting time. Plan your life. Don't hang around brushing up opportunities and fearing to step forward and to compete and to put your best foot forward. So that is part of what I have been telling them all the way from the bachelor's level students, I have told them. And I have learned that for the ladies, according to our societies, we have a lot of hurdles. There are so many hurdles, and a girl will put off taking her master's degree, which is part of the need, what she needs to be promoted, because she wants to wait around for a husband. I've told them, why don't you hustle while you wait? So it's part of telling them that your journey doesn't have to be like mine. You could actually do way better than I have done. You could achieve those milestones even faster, because right now you have someone who will tell you what is ahead. You have someone who will tell you, you need to network, you need to take up opportunities, you need to put yourself forward and really showcase your skills. So that is what I have been telling the young people I've interacted with. And hopefully, it has made a mark on them that they don't have to wait until the 100% checklist is ticked before they make their lives happen.
Absolutely, Susan. And I can see Karen, Oburu, Margaret, all agreeing with you, saying this is great, helping others to progress faster. And we have to be more intentional, just as Debora had earlier mentioned. Sarah, leadership matters in the health sector, yet there is skepticism that investing in leadership leads to outcomes at the individual, institutional, and at the societal level. Now, we've just had this great examples, and I'm sure you went through some more in the evaluation report findings. What can you comment on this in terms of outcomes, on us being able to see this tangible impact at both the individual, institutional, and societal level when investing in women?
So the report does cover the three areas, and I think, as I mentioned earlier, there's a clear increase in women's those who've taken part in the training, completed the training in particular. There is a clear increase in self-identified leadership skills, knowledge, capacity. So, you know, there's a very positive impact for women themselves who've taken part in the training, which is fantastic. There is also in the report clear evidence that women report being more likely to have an influence on the policies and practice of their own organization. So whether that's practice around EDI policies, equality, diversity and inclusion policies, or other aspects of human resources, for example, that women who've taken part in the training are better equipped to influence policy and practice inside their own workplaces. And then there's some evidence as well that women who've done the training are more likely to be in positions and places to influence health policy itself, whether that is, you know, there are multiple examples listed in the evaluation, and I see that there are links to the evaluation report in the chat box. So very much encourage everybody to take a deeper dive into the report itself. It's very, very clearly written. So the overall message there is that there are measurable benefits to taking part in the training program, including benefits on women's ability to influence policy and practice, both internally in the organization and outside. And, you know, kind of what more could you hope for in a program such as this? It's a fantastic set of outcome measures.
Thank you. Thank you so much, Sarah. And at WomenLift, we love saying when women lead, better health follows. And it certainly is articulated in the evaluation report, and also based on your own expertise within the area of research around this. I'm just going to mention, Alison says, such authentic, vulnerable, inspiring contributions from the panelists, and Sarah as an expert. Thank you for sharing your stories with such grace. So please do keep those comments, feedback coming in. And also, very importantly, we're going to switch to the questions and answers very soon once we're done with this quick round of opportunities and challenges in the face of leadership. Now, we at WomenLift Health are committed to expanding our leadership programs to serve women leaders in health around the world. By the end of this decade, we will have between 3,000 to 4,000 women who have been in the leadership journey, and thousands more who have been engaged in workshops or programs through their institutions. Importantly, as the women lift off, like we like to say, or graduate, they join an alumni community. And I'd like us to very briefly explore the opportunities and challenges as we think about the future, in particular, calling out of two big factors in the program: scale and time. Changing the face of leadership in the health sector. So, Susan, what does being part of the growing alumni community mean to you, briefly?
Thank you very much, Liz. For me, it's having a cluster of women, a growing cluster of women who I never knew about all over the, continent and beyond, who are doing health-related work, not just doing health-related work, but they are leaders in their field. That is like a gold mine, because we also have platforms where opportunities are shared, and you can share an opportunity or receive one and push it forward. That kind of support is very critical for a woman leader, because most times we are isolated as women leaders and we don't get that support we need from the peers. And we feel that the challenges we are encountering are ours alone. But having that alumni network actually expands the support and the shared learning, which I think is very useful for the woman leader.
Thank you. Thank you so much. I was just noting what Arathi Prahadlada has said, birds of a feather flock together, and nothing can be so good as a community that supports each other. Thank you, Susan, for that. Sanjana, can you speak to the value of diverse women leaders from across different health disciplines, sectors, and countries coming together through this leadership program and through the alumni community?
Thank you, Liz, for bringing up this important question. I think a diverse group of leaders in the cohort, in the alumni, that cuts through class and identity and sector and level is important and is much needed to be more representative of the huge women workforce that exists. So in our work, we do experience sharing sessions where our senior nurses, they share their life journeys. And when that happens, we see the younger nurses, watch them so carefully. And many times after the session is over, they come to us, they are a bit awestruck, and they say, Ki, we also want to be like Ganga Didi, like Kila Didi. Didi is the word we use here in India for an elder sister. So clearly, this kind of an impact would not happen if the person they are seeing is also not, if they are similar to them. And this is also something that Bandura talks about, the social modeling.
Mm-hmm.
I would just endorse more diversity. Thank you.
Absolutely. Thank you so much for that. Debora, do you see the benefit of more women going through the leadership journey, especially in the same institution? Have you noticed any impact on projects and collaborations, perhaps within the same institution?
So my answer is yes, I do think it's important. As I was entering the Center for Communication program, I actually learned that one of my fellow staff members, Grace Miheso, who's the chief of party in Kenya for one of our projects, actually went through the East Africa leadership journey. And Johns Hopkins actually right now has a couple of other staff members, faculty members who are going through the process. And just having conversations with these women, even as they've graduated or lifted off, or as they're going through the program themselves, as is the case with two cohort members of the current cohort, it's just impressive. It's something that we all share, and it's an allegiance that we have to each other and to other women, and that we start really realizing that we hold the power here, and it's not the other way around. And that there is even greater power the more we help other women join us and help us grow this important, I'm going to call it movement. I really think that, male allies are great. And there's nothing wrong with that. Sponsorships are great, having male and female sponsors. But there's nothing like having women in this group help you even after you have lifted off, even while you're going through the journey yourself. And it's like you don't have to totally explain what you're feeling, what you're going through. We just know. And I think that there's some peace to that. And just understanding that we're all starting from the same even level. And it's something that I continuously appreciate. I cherish the women that were part of my cohort, and appreciate those that were not, but are part of my network.
Wow. Fantastic.
Yeah. So
those are really great insights around how you can collaborate within an organization. Now, Sarah, let's imagine 5 years from now, and you're reviewing the evaluation report for 2029 with over 3,000 women having had the leadership journey, with their careers having progressed anywhere from 1 to 9 years since they were in the leadership journey and joined the alumni community. What do you expect or hope to see in 3 quick points?
3 quick points. Okay, first of all, I would hope to see that after, wouldn't it be a great dream if by 2029 we could all say, well, that's it, we don't need to do this again, because there is a sufficient change across society that everybody is given an equal opportunity to progress their career in just the way they want, irrespective of their gender identity. Wouldn't that be great if the report could finish by saying, thanks very much, our work is not needed anymore? But more realistically, what would I expect to see? I would hope to see that that despite the kind of obvious challenges coming up the way to all of us over the next 5 years in terms of a very regressive political climate for promotion of gender equality globally, that despite that, we are still going to see this program in operation and making the waves of changes that it needs. But I mention that because I think that we need to have very clear and upfront discussions amongst ourselves about the very adverse political environment in which progress towards gender equality or promotion of gender equality is trying to take place. We are facing enormous political pushback in many of the countries represented on this panel. I'm sure within the attendees, certainly, it's hard to think of too many countries where we're not facing pushback. And that includes pushback within the workplace on schemes and programs and money going and other interventions going into creating what previously we have described as equality or even equity of opportunity for everybody, that there is a huge resistance to that. And so I think the better prepared we are knowing about that resistance, the more likely we are that in 5 years' time, that we will have seen that we have been able to push back against against that tide that is coming our way. I think, the other thing I would love to see in 5 years' time is that where women have really been able to make a difference is in the domestic sphere. Because I'm going to just tell you, don't just take it from me, take it from Claudia Goldin, who won this year's Nobel Prize for Economics, that where women's careers really fall off a cliff edge is at the point of motherhood. And until we actually sort out what's going on in the domestic sphere and have absolute equality of responsibility for domestic labor, then we are going to need this program forever and ever. And so fantastic as it is to have many, many interventions in the workplace, the real challenge is for all of us to go home and make sure that we're fighting for equality at home too. Thank you.
Thank you. Thank you so much, Sarah, for those insights. Would love to see that. And you bring in a very important point on the domestic sphere and more resonance and people thinking about that more. We have been collecting your questions throughout the panel discussion, and we'll start very quickly with a question that has come in since we were, Sarah was just the speaker right now. Sarah, did you, Zed here asked, did you find any information about how feminist leadership is being received in organizations? Any evidence of real shifts in the distribution of power in organization? And if so, what seems to have enabled this? Maybe in 1 minute.
Thanks, Liz. Funnily enough, we've actually just done some literature reviewing on that very topic. And I have to say that I think as a reflection of how really challenging it is to get resources allocated to answer this kind of question, there's almost no literature. There are some case reports from places as diverse as South Africa to Indigenous women's groups in Canada, but they're very scattered case reports about the difference that feminist leadership can make. For those that are interested in the principles, practice, and kind of the ideas of feminist leadership, I'd really strongly recommend taking a look at the work of Srilata Batlivala, and I can put her the report details into the chat, because she writes fantastically on what we mean by feminist leadership and the difference it can make.
Thank you so much, Sarah. And this is also content that we can share on the post-webinar email that we'll send out to all our participants. Srijana Kaki is asking, and I think this is a question for any of the alumni, and I think I'll let you answer very quickly in 45 seconds each. How do you now define leadership, and you being a leader and leadership with your experience, how do you deal with challenging and tough situations? I'm going to start with Sanjana, Debora, then Suzanne.
Thank you for the question. I'll answer the second part, managing a tough situation. I spoke about how I defined leadership earlier. So yes, tough situations come. And I think, being more authentic, sharing my own, my doubts, my fears, but also trying to then see what would the best answer be, connecting with others, taking their ideas as well. Sometimes just sitting, taking a deep breath, thinking calmly. I think using all of these. And I'll also borrow something what Debora said, I may fail sometimes, but as long as I'm intentional, I'm trying to do my best, I think that is okay.
Just like Sanjana, I hope describe well or clearly what I feel is a leader or leadership in my experience. To extend on that though, I would like to say that a lot of times we confuse leader with a title. Like you don't have to be a leader. You don't have to be a leader, a manager to be a leader, or a vice president of an organization to be a leader. It's really something much more than that. And it's really about being a visionary, aiming for a legacy that you want to leave, you want to intentionally leave. And I think that just like Sanjana noted, our goal always when there's challenging situations is to listen, consider all options, and then make your best judgment, recognizing that you may make a mistake, you may have to tweak the judgment that you just made, but embracing that and being brave about making a decision is also about being a leader. We will not always be liked for the decisions that we make, but as long as we're being intentional and meaningful about it, thoughtful about it, that's actually what's really important.
Susan, over to you. Thank you, Debora.
One of the, I would say, highlights of the leadership journey is working through our conflict styles. And I think we went through that where we were put in groups to figure out how we would manage certain situations. And difficult situations will happen. You need to know yourself. You need to know the people you're working with. And you need to know that you don't have to have a winner or a loser, but you need to work through it and see how you can collaborate for the greater good of the workplace. Because you are not going to fire someone just because you had a disagreement. So as a leader, I have learned that you need to compromise sometimes. Sometimes you need to collaborate. You need to see what you need to lose in order to find the middle ground or the comfort zone with whoever the conflict is with. But one thing that is for sure, you don't run away. Some of us like to run away. Especially when you're conflicting with someone who you think is bigger than you. But as a leader, you need to stay and face it and see what you can compromise and find a middle ground. It's a learning process, and we don't all have it pinned down. But with every battle, with every war you fight, you pick up a lot of lessons. Mm-hmm. That is what I would say.
Thank you. Thank you so much, Susan. Anima Sharma says, this is such a wonderful and insightful discussion. Some time back, people used to say that women are the greatest enemy of each other. But I never supported this idea. After all, that women had also been, women also suffer. It is just individual behavior, but not universal. Now, the trends showed that a woman as a leader is more understanding and helpful to another. The differences may occur in as it does among the men too. Sarah, your quick comment on women are their own worst enemy and what this evaluation report demystifies about this.
Gosh, the myths of the patriarchy, eh? I would just like to say that the thing that really struck me across all of the points of the evaluation was the word collaboration. That again and again and again, what women came back with was how much they had learned from collaboration, how much support they got through collaboration, how beneficial networking was. You know, I don't think we should kid ourselves that this is representative of all women. I mean, by my age, we can all name, well, perhaps not publicly, but the female bosses we've had that we wish we'd never worked with or been subject to. But I think that, you know, with the air of sample bias in terms of who takes part in a program like this, what you're going to find is an amazing network of women to collaborate with, women to support you and give support to each other and be on this amazing journey with.
Thank you so much for articulating that. Debora, Sanjana, Suzanne, as we wind up, one word, just one word that when you reflect about your leadership journey, one word that could describe it. Debora.
That's tough. Inspiring.
Inspiring. Sanjana?
Yeah, it's so tough. Yeah. I would say authentic.
Authentic. Inspiring, authentic. Susan?
Transforming.
Transforming. Oh, wow. It's been such a delight. It's been such an insightful discussion as we've explored the findings from the evaluation report that you can read more on the links that have been shared about WomenLift Health's leadership program. And I want to just summarize a few points highlighted by our speakers and highlighted in the report. One, pathway to change. As women build their confidence, expand their networks and their leadership competencies, they grow their sense of self-efficacy, which Sanjana did talk about on her leadership project, or mastery as a leader. It translates into action. Women leaders become even more purposeful, using their leadership power for change in their own career, in their institution, and collectively in the global health. Women enhance collaboration and peer connections on their leadership journey, supporting one another in leadership development, navigating workplace challenges, and celebrating successes, which we often forget to do, building confidence and realism about their leadership skills, and in doing so, overcoming imposter syndrome. As part of our commitment to advancing women's leadership in global health, I'm delighted to invite you all to join our global conference that will be held in Dar es Salaam, Tanzania, between the 6th to the 8th of April. The links have been shared with you on the chat with the theme of reimagining leadership, new approaches to new challenges, which really captures the one word that our panelists have talked about. The conference will celebrate women and men who are demonstrating transformative leadership and allyship and pioneering bold approaches to policies and programs that are moving the needle on gender equality in health. Over 3 days, participants from across the health field will explore what redefining leadership looks like, acts like, sounds like. And we'll be also looking at interactive workshops and trainings. More details about the conference have been shared in the chat, and we look forward to hosting you in Dar es Salaam, Tanzania. Tremendous thanks to our 4 amazing panelists and to everyone in the audience who dedicated their time to participate and contribute in this crucial discussion. The evaluation report is available on the WomenLift Health website, and we've also put the link into the chat line. This recording will also be made available to you all on our YouTube platform and to other digital platforms that we have. Thank you so much for your time and have a lovely week ahead. Thank you.